Hi, I'm Tamara Walker. I'm from Holly Downs here at Augathella.
Yeah, Paul, Tamara's husband.
I'm Kevin. I'm from Holly Downs here at Augathella too.
Alright, and I'm Holly Downs at Augathella.
The only time I've used telehealth personally was with my young fella. He had to get an operation done in Brisbane at the time. He was only 2 years old. And it was just unreal because he hated travelling. I hate travelling. And it saved us nearly 9-10 hours driving. The doctor was unreal, did drawings. You could see it all on the computer. If we had any dramas, he explained it like it was just as if we're in front of each other. And it's, you know, you're losing, I'm casual, so I get day pay. So going to Brisbane and back, you lose nearly 3 days pay.
Especially when, you know, you go to, what do I do, 6 hours driving to see a specialist and see him for 10 minutes. You know.
That's what does hurt.
Yeah, you're only there for 15 minutes, 20 minutes, and you've just driven 6 hours.
We pushed for him for a telehealth there at one stage, and we couldn't get it at that time, could we?
No.
And we drove down there, and the whole consultation was we walked in the door, he sat us down, checked the young fella over, we were there for 5 minutes, and then we had to turn around and drive back, like
16-hour day.
16-hour day, you know, like for 5 minutes.
Could
have done it over the telehealth if it was available at that time, like with that surgeon, and saved us 2 days pay and a lot of time. Everything's so expensive this day and age, like the price of fuel, you struggle to drive 80 k's.
If I couldn't do telehealth, I just don't think I'd do the appointments, I'd suffer.
I cancelled a specialist appointment the other day for the same reason. It was only going to be a 5-minute consultation. Like I said, 16-hour trip for a 5-minute consult. No.
A lot of the people off the land, they seem to deal with the pains and that because we don't have that facility. Like we can't just 10 minutes down the street see someone about our health, like if it's that bad, so they deal with it. Lack of the doctors out around the remote sort of areas, like they're just not here. It's all fly in, fly out. You have them for a week, you're not sure whether you got them the following week. That's a fair bit to do with it out here.
It is difficult being out here, but as I said, the telehealth's been unreal to change. It's a game changer.
But it's just the convenience of using telehealth. It's there, it's 5 minutes into town. It just needs to keep going, you know, and only get better as we go on.